it's a nice area for us to present and also to follow up the presentations from the previous speakers. So we will go into the resilience potential, which I think is really important to understand resilience. So you can talk about organizations have potentials for resilient performance, and that is really interesting to read what Eric has written about this stuff and how he has developed his ideas, I think, along the way, because he started with the resilience cornerstones, and then it developed further into the resilient potentials, which is important for organizations to actually be able to survive. So if you're able to have to respond to these potentials, you are able to kind of survive challenges, changes, risk, and adapt to them in a way that is making your work continue. So the resilience potentials are necessary for an organization to perform in a resilient manner, and there's a very interesting discussion that he has in this book, which I like a lot. So what is a potential, and how many potentials are there, and are there possibilities of further potentials? We will go through the 4 potentials here: anticipating, responding, monitoring, and learning. And we will talk a little bit extra about the learning potential, which has been a main interest of our group. So I thought it was okay to share that with you. But if you're looking into the potential to anticipate, this is a lot about looking ahead. So what can you expect? What do you have to prepare for? How will the future develop based on the past? What are the options, the threats, the risk that you are facing? And how can your work be disrupted? And what are the conditions that you are working under? And this is interesting. And then you can think, what does that mean in practice? So we have been working with these potentials in our research. And I thought it would be okay to just use a couple of examples for each potential of how we have used the potentials when we looked into organizations as part of our research activities. So we are quite a large research center in Norway, and a lot of our work is into the resilience field, and we've been doing a lot of empirical work to investigate resilience. And we have used these potentials in many ways, and I thought I would use one of them. And if you looked into, in this book, we have a chapter I thought it was okay to use, because then we did a large observation and interview study at maternity wards in Norway, and we were looking into them, and we used the potentials to try to understand how they actually worked. And when we looked into the anticipation element, we focused what are the mechanisms that they are using at this maternity ward when they are working, trying to perform in resilient ways. So we could see how they use, of course, the procedures to look ahead, what could happen, how they organized their department, how they had forums to discuss at department level. They discussed safety, to trying to find out what are the potential risks that we are facing, how's the situation on our ward today. They used equipment to be prepared. They could have this emergency kit, they had alarms, so they could be able, they kind of expected what could happen. How they composed their teams were part of these mechanisms that they used to be best as possible prepared to respond to the anticipation potential. And if you're looking at the potential to respond, that is about how you are able to adjust and respond to expected and unexpected conditions and changes and risk, opportunities as well. So if things go well, you should be able to repeat it. And how you prepare and how you activate responses. And also how you invent new ways. And if we looked into this maternity ward that we observed, we could see how they use different kind of mechanisms for responding and being able to respond. It was a lot about how they used resources and had flexibility. So they always had a buffer capacity in their organization because they knew there would be peak situations. So then they had to reallocate the resources in their organization. They used collegial support and professional support, and how they also used quality improvement in group processes to actually improve their ability to respond. And focused a lot on use of learning and experience with the IT. So if you actually look into the potential to respond, what does it look like, you can see different kind of mechanisms in these organizations. And for us, these frameworks were quite useful. You're looking into the third potential. It's about monitoring, so trying to understand your status of your organization as it is. It could be quite difficult, and knowing what to look for and being able to monitor both the organization and environment, so where you are working within, but also the operating environment, so at the maternity ward, but also the maternity ward was quite influenced by the environment. And in Norway, for example, we know that if you're having your child enrolled into kindergarten, you should give birth before 1st of September. So if you are giving birth after 1st of September, or what date it is, you will have trouble getting your child into a kindergarten. So you could see a peak coming in early or in August. And then they could monitor these kind of indicators, you could call it, in their organizational environment, but also within. And they could, of course, use different kind of tools. So it needs to cover both performance within the organization and the environment, the activities that you do when you're trying to monitor the situation, so that you are prepared for handling and responding properly. Meaning that you need different kind of mechanisms to monitor, or tools, for example. So we could see how they use quality indicators. In Norway, we have different kind of national quality indicators in maternity care they could use, but they are not very operationalized into the practice field. But at a hospital level, they could use it. But they also use different kind of screenings, monitoring the baby and the mother giving birth. And you could see that when we're wearing green clothes, observing, we could see how all these activities occurred at the maternity ward. And how they also used reporting of event as a way of monitoring their own response or performance. And the learning potential is also, seems very easy, Cecilia.
Yes.
Yeah, you have to learn. That's very easy, but it's actually pretty complex. So you need to know what happened and to learn from the experience, including the successes, RHCS, and failure, making sense of the experiences over time. And I think this is an area where many of us have been thinking this is straightforward. But when we have been working on it the last 5 years, we have been digging into more of the details of what's happening and what is it that we need to do. So Cecilia will come back to this, but when we looked into how the maternity ward did, they had a lot of activities actually focusing on the learning element in their everyday work to improve their performance. So they used simulation. They used simulation when they had time. They had these mannequins in their departments that they could use when they have extra time, because you know we don't necessarily know how many births will be given each day. So sometimes there were too many people and too little work. And then they used simulation. They trained new employees working on how they had openness of a culture of not blaming and focus on that. This was a hospital that had been characterized a little bit of the culture of kind of blame aspects. So they worked a lot on that. And also how they used quality improvement projects to create learning processes. So they gave people responsibility for being part of quality improvement projects and also integrating the knowledge into their organization. And they also used job rotation to learn across and also between experienced and non-experienced professionals. Then, Cecilia, you will go more into the details of the collaborative element, because we thought it was time for more details on that.
Yeah. Yep. So as Silje said, all our work is based on Nagel and the 4 potential, but we believe that learning in particular are important, because if we don't learn, we can't really improve. And that everything we do, we should learn something from it, both from what we do wrong and what we do well. So so this work, we went kind of further into the learning component and trying to see what it is about and how and what can we learn. And in particular, we were interested in the role of collaborative learning in this work and what role that plays in resilience in healthcare. So this is based on an article that we have written, so if you want to just saying that if you want to read more, you can dig into that one. But as Ellen has beautifully explained, we operate in complex adaptive systems. And the point here is that complexity comes from the web of interactions that we all are a part of, and that no single component can completely understand the whole system. And therefore, everything is unpredictable, and we actually have to create the safety as we go along by anticipating and looking at what's happening. So this complexity means that we also work collaboratively, and that all the interactions that we do, we have to do with others, because we can't really do our jobs on our own. We are dependent on someone else to help us, either the patients or the next of kin or our colleagues or another unit. So since we are highly dependable on collaborative working, we also believe that we are dependent on collaborative learning, and that we actually need to learn together, because that is how we work. And also trying to join the work as imagined and work as done, because it's maybe we are actually working together, and we need to learn together as well. So the definition of collaborative learning is a bit tricky, because everyone, or a lot of people talk about it, but when you're trying to define it, there might not be a single definition. But there is a consensus, I would say, that it comprises something about that a group of learners working together to solve a problem or complete a task. And I think that pretty much describes what we do every day in the healthcare system. So what we have done was actually going through a lot of different safety projects, trying to describe what does the healthcare system actually collaborate about, and how do they work and learn together. So the purposes for collaboration is in 3 different areas. So first of all, they collaborate in order to respond and adapt to the changes that they are facing all the time. This could be government-initiated reforms, budget cuts, introduction of new tools, caring for a patient that changes in his presentation, or involving next of kin. It is also a collaboration to maintain processes and functions. For example, admission and discharge are dependent on a team contribution from different stakeholders, such as physicians, nurses, and next of kin, and the patient themselves. They also collaborate to actually improve service quality and patient safety, as Siri explained and talked about. And they develop, for example, risk-based selection criteria to decide where women in labor should give birth, or provision of meeting places for knowledge exchange, for example. We also looked at what the collaborations and the activities and interactions and what they actually do. So obviously, one of the things they do the most is exchange information. Like the collaborations is often about discussion a patient's condition, or involving the next of kin and talking to them and getting information, or having meetings in the municipalities to negotiate how they're going to do a reform, for example. They also coordinate, negotiate, and align different needs, because in every collaboration, the involved parties also often hold different needs and different expectations and preferences, and they need to negotiate to find out how they're going to align these needs. They also highly collaborate to develop different buffers, because that is, as we discussed earlier, like, the margin and the line, and how they can actually help develop these buffers, such as simulation-based training scenarios, to be better prepared for diverse situations. One of the interesting things that we might not think so much about is that how do they actually learn? And often we think about learning, if you ask people, like, what did you learn and how did you learn? They said, oh, I didn't take a course, so I didn't learn anything. Because that's often what they think about when we ask them, like, do you do any learning? So we have learned that we shouldn't ask people what they learn. We should just ask them to tell me what you do. And then they talk a lot about learning. So they learn, do every activities of everyday work. So because they actually engage in a collaboration with someone, they often learn something just doing exchange information, consultations, discussions, prioritizing which patients to take first, or responding to someone's needs. But they also learn during intentional education activities, such as, for example, workshops, seminars, simulation-based training exercises, and stuff like that. But the point here is that we see that they actually learn from all the activities that they are engaging in. So what the point of this is that we believe that the resilient performance and the ability is highly dependent on the ability to adapt. And the ability to adapt is closely linked to the ability to learn and actually anticipate and see what's happening. And so the ability to learn, both by individuals, teams, and organization, we must learn together as an organization in order to be able to improve and adapt correctly or successfully. So we believe that the learning component also is about, maybe we could also say that it's about collaborative learning and learning together as a team. So that was it.